Hello and welcome to McLaren Port Huron's Today's Health Program. I'm your host, Michelle Baker. Today we'll be talking about arthritis of the knee and how to treat it with board-certified orthopedic surgeon Dr. Leonard Karadimas. Dr. Karadimas, welcome back to the program.
Thank you, Michelle. Great to be here.
Let's start with a review of the anatomy of the knee.
Okay, the anatomy of the knee. On the screen here we have the top bone's the femur, the bottom is the tibia, and where they join, of course, is your knee joint. There's a little bone in the front called the patella or your kneecap. And it's basically all stabilized by these ligaments in through here on the outside, the collaterals, and the center of the cruciate. There's actually a small model right here. It gives you maybe more of a three-dimensional look at it. So femur, tibia, where those two come together is the knee, and that it articulates kind of like a hinge almost. There's a little bit of rotation involved, but mainly kind of like a hinge, and the kneecap sits in front. And the ligaments are the things off to the side that stop it from going too far this way or that way. And the ligaments in the center, the cruciate, stop the knee from going too far forward or backward.
What are the main causes of knee pain?
The main causes of knee pain are going to be usually cartilage problems. Cartilage deterioration, which is arthritis, tears in the cartilage. You can certainly have traumatic type injuries that occur, sprains, strains, ligament injuries, and so forth. But the vast majority of symptoms we see, chronic, long-term problems, are going to be wear and tear type issues.
So you mentioned arthritis. By this, you're talking about osteoarthritis. What are the causes of this?
Well, it's a multifactorial etiology. In other words, multiple factors contribute to osteoarthritis. More often than not, it's wear and tear, but certainly you can have trauma, you can have comorbidities, other medical problems that one has can maybe predispose you to arthritis. Certainly weight can contribute to it as well.
What are the common symptoms of arthritis?
The common symptoms are going to be, the most common is going to be pain, overwhelmingly people that come to my office that have osteoarthritis are there because it hurts. But other symptoms are going to be stiffness, swelling, crepitance, a little crunching sensation, giving out. Those would be common things for people to have with osteoarthritis.
Now, if you're having knee pain at home and you think it might be arthritis, are there any things that you can try to do before going to see your doctor?
Sure. Like anything else, I think, the more active you are with it, I think it's better. It's always better to kind of, keep things moving. You can try some over-the-counter, low-dose anti-inflammatories. If you have some swelling, maybe some ice on it. At
what point should you say, okay, I need to go see my doctor?
Well, I think if your symptoms are not responding well to, the anti-inflammatories, they're, starting to cause you to have some limitations in what you do, and certainly if it's a daily pain, I think you should probably have that evaluated.
Dr. Karadimas, this is great information. We need to take a break. We'll continue in a moment.
Perfect.